CEO of Westchester Health Center. She immigrated to the U.S. from Jamaica, West Indies, at the age of 7. After graduating from White Plains High School, she joined the United States Army, serving actively for 3 years and then in the reserve for 7 years, achieving the rank of Sergeant E5. Watson's career is marked by her dedication, work ethic, and desire to help others. She pursued nursing, earning a Bachelor of Science degree in registered nursing from Pace University and a master's degree in public health from New York Medical College. Her nursing career began at Greenburgh Health Center, now WCH Greenburgh, in 1984. She later merged with Mount Vernon Neighborhood Health Center in 2025 and has been with the combined entity for over 30 years. Throughout her tenure, she has held various leadership roles, including Executive Director of the Greenburgh Health Center site and Chief Operating Officer of the Mount Vernon Neighborhood Health Center, culminating in her current CEO position. She is deeply committed to ensuring healthcare access for all, especially the most vulnerable. Her responsibilities also include producing a public access television show, participating on several boards, and serving as an adjunct professor. So let us give a warm welcome, a warm Irie Jam welcome to Judith Watson. Good morning, Miss Watson. How are you?
I am doing well, thank you. Good morning, good morning.
I am so excited to hear all of the things they're talking about, coming to the shores, leaving the shores of Jamaica, coming to America to chase that American dream. And it sounds like you are doing just that and walking in your purpose. So as someone who immigrated from Jamaica at a young age, how has your cultural background influenced your passion for healthcare and your dedication to serving diverse communities, particularly those in need?
So I have to tell you that I was born in St. Anne, Jamaica, Clarksonville, K Valley,
Yes.
way up in the mountains, no running water, outhouse, no plumbing. So I come from very humble beginnings, and so I know that there is need that's out there. And just because it was in Jamaica doesn't mean that the same doesn't hold true here in America. There's lots of needs out there for healthcare.
Yes, 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 yes. So you came here and you went to school here and you decided to go into the army. What was that like?
It was amazing. It was amazing. I was one of those troubled teens who came here from Jamaica, confused, migrated to White Plains where there weren't a lot of Jamaicans. So I was feeling very uncomfortable in my skin, in my own skin. And, I was one of those troubled teenagers, and the Army just straightened things out for me. Got the discipline that my mom had been trying to instill in me for all these years. It taught me about esprit de corps and pride and, organizational skills. And it just prepared me for the world, prepared me for my life.
As we celebrate Caribbean American Heritage Month, you touched on something that I think a lot of people that leave wherever they're from. You left Jamaica, but a lot of people left wherever they came from, and they came to the shores of America to integrate into American culture and society. And if you don't know anything about America and you're trying to kind of get your sea legs, then that identity or that self-identity or realizing where do you fit in, right? You said you were a troubled teen in White Plains. How do you think people, or what advice would you give to someone now that you've done it, navigating just kind of integrating into society?
Honestly, it's just to learn more about the society that you're in. Try to stay in touch with the society from whence you come, because I was one of those just sort of lost souls. I didn't feel connected to the Jamaican culture. Obviously, wasn't 100% connected to the American culture. I was just sort of in the middle, sort of floundering. And I have to tell you, at 57 years old, I'm still trying to find my place of comfortability. Is it with the Jamaican culture or is it with the U.S. culture? You see? So it's just to basically expose yourself and to get yourself educated to both cultures and really try to understand where you fit in here.
For many in our Caribbean and immigrant communities, understanding and accessing healthcare can be challenging. What are some of the key initiatives Westchester Health Center is undertaking to make healthcare more accessible and culturally sensitive for these groups?
Wow, that's such a great question, right? So the federally qualified health center, and mine is specifically Westchester Community Health Center, there's 75 in New York State with multiple sites. So I'm one with 9 sites. There's some with 50 sites, there's some with 2 sites. So there's 75 in the state, and there are 1,500 with 9,000 sites nationwide. So we were born out of the need for there to be a safety net. And now more so than ever, it is this work that we do is so important. So we're the safety net. So when folks have no place else to go, this is where they come. And by the way, we get a lot of folks who can go elsewhere, but they choose to come to us because we're the best. But we were born out of the need for folks to have place to for folks to have a place to come when they're in need of health care, whether they have insurance or not, whether they have legal status in the country or not. So that's what we do. We've assembled a team of staff with over 300 that look a lot like the patients who are walking in the door. So when you come in here, you feel at home. You know that the leadership, the doctors, and the other providers, and the rest of the support staff, they look like you, so they understand you. In terms of initiatives, so you name it, we provide it, right? So internal medicine, pediatrics, OBGYN, dental, mental health services. But what makes us so super special, right, are these support services that we provide. So not only are we providing medical, dental, and mental health services, we're providing food. We're providing digital literacy training programs, right? We have Alzheimer's programs, right? Lots and lots of education programs. We provide transportation. We assist you with getting insurance. There is no end to what we do here to serve this community.
I love that. And thank you for doing that. Thank you for rising to the occasion and seeing the need and stepping into a position where you can affect change, right? Where you can help out the very person, the very little female like yourself who came to the shores of New York or America and said, you know what, I don't really know my place, but I can find it and I can get health services at Westchester Community Center. Thank you for that. Now, given your focus on the most vulnerable, what specific health disparities do you see as most pressing within our communities that you serve, and what strategies are you employing to address them?
You know, I like to think that most people know, right? That we meaning Black people, Caribbean people, right? We are disproportionately impacted with diabetes, cardiovascular disease, hypertension, right? Cancers, various forms of cancer, asthma, okay? And I think that I like to think that most people know this because we all have these families, and in our families, we have folks who are impacted by this, but no one has yet been able to master why we as a people can't understand that these medical issues that exist that disproportionately impact us, there are preventative measures that can be put in place, right? I grew up with my mom saying prevention is better than having it to cure. Prevention is better than, and I thought that that was some old backwards, something that she came up with, but it turns out that that's my life's work today is prevention. So we've got to get our folks educated on the fact that these disparities exist. And we have to make sure that they understand what to do to prevent these illnesses from developing. And if you already have them, prevent them from getting much worse. We all know that for example, diabetes uncontrolled will lead to amputations and eventual death. We all know someone who's been impacted with that. And so what we do at the health center is we try to get the word out. We have a mobile unit that deploys out throughout the community here in Westchester County and the northern parts of the Bronx, and we're looking to expand our services. But we try to get the word out, and we do our best to try to take care of those folks who look and sound like us.
Now, in moments of challenge or overwhelming need, what keeps you motivated and re-energized to continue leading the charge for equitable healthcare in underserved areas?
You know, I have a higher power who I choose to call God that sort of directs me. And it's interesting. I am single, no dependence. I am in a relationship, but I'm technically single, no dependence. And I know that God has put me on this earth for the specific purpose of ensuring that quality comprehensive health care is delivered to these folks who are coming into our 9 sites throughout the county and northern Bronx to receive health care. So every morning I get up and I'm like, all right, God, I'm your instrument. Just lead me. Sometimes I wake up, I'm exhausted, I'm frustrated. There's a lot that's going on right now. The federal landscape is complicated, but I know that God has a plan for me, and my plan, and that plan is for me to be here to ensure that this organization is sustained for generations to come, providing this care to these folks who are coming in these doors.
So it sounds like you're saying you are walking in your purpose.
Absolutely.
And I'm a big purpose advocate. So I just want you to just kind of tell our listeners, right? There's a young girl right now that is just, she can't find her way. She doesn't know where she fits in. Talk to her about the importance of finding that purpose.
Oh my goodness, it's interesting. I was the commencement speaker, not to toot my own horn here.
No, toot your own, toot.
I received an honorary PhD last week.
Congratulations.
Thank you. An honorary doctorate degree from Mercy University last week.
Wow.
And I had the pleasure of speaking at their graduation. And the theme for my speech was, your life is predestined. It's laid out for you. It's laid out for you. All you have to do is suit up and show up, right? Don't ever say no. Don't ever say no when asked to do something. That's not my job. I'm not doing that. Always say yes. Do the best that you can, because your life is predestined. It's already laid out for you. Your path is laid out for you. All you have to do is suit up and show up and just do the right thing. Treat others the way you want to be treated. Get an education. Have some fun in life. Love your family. Seek a power that's greater than yourself. It's laid out for you. You just have to suit up and show up, and it will all fall right into place.
It will. It will. Listeners, listen, gems are being dropped, okay? You are prepared already. You're predestined. He already gave you the gifts. Okay, it's for us to kind of step into those gifts and unearth them. Now, as, let me say, Dr. Watson, as CEO, what is your overarching vision for Westchester Health Center, and how do you plan to continue its legacy of providing comprehensive care while adapting to new healthcare challenges?
You know what? It's very simple, and I tell this to the staff all day, every day. I intend for the patients who walk into any one of our 9 sites to receive the same care, if not better, than the care that someone who doesn't look like them walks into another facility and receives. So I intend for our folks to benefit from the state-of-the-art equipment, state-of-the-art knowledge, cutting-edge stuff, research. I want the folks who come in here to receive the same level and better of treatment than folks who don't look like us. It's as simple as that. And with regard to sustainability, it is my goal, and we have an amazing board of directors, and they support us and they direct us, and they understand the assignment, right? They understand that it's about quality care, and it's about sustainability of that quality care. So everything that we do is with that as our North Star, is to ensure that this organization is sustained for generations to come, as it has been for the past 51 years.
Now, we understand you're involved in public access television show and other community roles. How do these external engagements complement your work as CEO and help to educate and empower the community on health matters?
Got it. And in all transparency, I haven't done that show. I had a monthly show. I've been CEO. I've been here for 31 years. I've been CEO for 6 years. But since I've been CEO, I haven't had a lot of time for that show. But what I did on that show was monthly. I would bring on a guest that could speak to whatever the monthly medical observance is for that month. So if it was, for example, diabetes month, right, I'd bring on an endocrinologist who can speak to diabetes. So that's sort of the way the show, that's how the show was situated. What was the second part of your question?
Well, how does you're playing into these roles, right? Yeah.
Absolutely. Thank you. Sometimes I'm telling you.
No worries.
57, it happens midway in responding to something. You're like, okay, what was the question? So I sit on 14 boards,
Wow.
including the board of, say, Westchester Medical Center and so many other community boards. And I do that again, it's purpose, right? And I
Mm-hmm.
want to ensure that this voice that I believe is reflective of folks who look and sound like me, I want to be sure that this voice has a seat at the table. And so when decisions are being made, I want to ensure that this voice gets to chime in, right? And so that's a part of it. And then the other part of it is that I learn, right? Everything my mother always says, it's school that you're going. You're going to school. It's always school that you're going to.
Mm-hmm.
And so I bring back all of that knowledge and expertise that I learn on those boards and apply them to this organization to see how do we measure up, right? This is what's cutting edge and this is what's going on out there. Or what are we doing here toward that?
Now, for young Jamaicans and or other Caribbean youth aspiring for careers in healthcare or leadership, what key advice would you offer them based on your journey and achievements, especially concerning service to others?
First thing is, and I'm always going to give a plug for the federally qualified health centers, right?
Mm.
Find a federally qualified health center. You don't have to just, it doesn't have, you don't have to only have a medical background. Obviously, we have finance teams, we have IT folks, we have
Mm.
folks who work in supply. There's so many and lots of different programs that doesn't require medical expertise, but that support the health centers. So I always have to give the plug for the federally qualified health centers because, again, we're the safety net and there is so much need. There's no amount of need that we can't meet if we're able to bring in new people to continue to ensure that the health centers are sustained. So find a health center, get involved. And if it's not a federally qualified health center, find other organizations who are serving people who look like us and who sound like us,
Mm-hmm.
right? There's a lot of need that's out there for your assistance.
And I'm glad that you touched on that because a lot of us think that when you think of something like a Westchester Community Health Center, you're just looking for persons that are accredited in the or licensed in the medical field. But you're right, there's so many other teams that need the support, right? So if you have expertise, as she said, in IT, graphic design, whatever it is that you have a field, the license in, but you also want to be of service and are you a people person, they probably will need your services as well. Now, Ms. Watson, what essential message do you want to convey to our Ira Jam Radio listeners regarding their health, seeking care, and the resources available at Westchester Health Center?
I have to tell you, good gosh, take better care of yourself.
Mm.
Take better care of yourself. Every single one of us has someone in our family who has high blood pressure, who has diabetes, who have had a stroke, right? We've got to, as a people, take better care of ourselves. I love all of the Jamaican everything, the curries and the oxtails and the carrot cake with the nuts, to be specific. But moderation is the key. We've got to get the exercise. We've got to eat better. Treat yourself. Yes, absolutely. My mother went to a doctor once and she said, what can I do to learn? What can I do to lose weight? And the doctor said to her, back up from the table. Okay? This isn't rocket science. There are millions and millions of dollars that's being put into what can you do to lose weight. And I know now there are the injections and
Mm-hmm. Mm-hmm.
revolutionary stuff that's going on, which is one of the reasons why I love healthcare the way that I do. But moderation, take better care of yourselves. You can't take care of your families if you're not taking care of yourselves. And we can all do better. We all fall short.
Yep.
I don't care how fit people look or talk, we all fall short. But we as a people, we've got to take better care of ourselves. We got to educate ourselves. Prevention is better than having to cure again. Come for your annual GYN checkups, right?
Mm.
Because prevention is better than having to cure. So if you know about something early, it can be treated earlier, right? I would go for my annual mammograms every year, and my breasts were always cystic. Well, the long and short of it is, turns out I had breast cancer, but it was caught so early that I was able to do a double mastectomy, get implants, back to my normal life. You see?
Wait,
Why?
wait, hold on. You can't just throw that at me and then just, but you know what, Miss Watson, we're gonna have to have you back on to unpack all all of that, because what you're saying is right. And just that little nugget you just shared there is a story for somebody. And I hope that these women, please go get your mammogram. Again, Dr. Watson says prevention is better than cure. If you can prevent it, you want to prevent it, you don't want to cure it. You want to prevent it, you don't want to cure it. Now, Miss Watson, I God, you just threw me off guard, because now I just want to talk, but I'm looking at my timing. All right, tell us where we're gonna have you back on. Nakia, Electra, please reschedule Miss Watson to come back on immediately. Tell us where our listeners can find Westchester Health Center, the website, IG, all the things.
Oh, yes, absolutely. So it's westchestercommunityhealthcenter.org, westchestercommunityhealthcenter.org. Just type it in and Google it and it'll all come up. We're located in Mount Vernon, which is where the mothership is. We're in Greenburgh. We're in White Plains. We're in Valhalla. We're in the schools in the city of Mount Vernon. School-based health centers, a lot of people are not familiar with, but imagine having your pediatrician right there on site at the school. So if your kids need vaccination, if your kid is sick, they just go right downstairs to the health center that's on site at the schools, and they're cared for. We have the mobile unit. I did say Yonkers at 30 South Broadway. We're expanding that site. And so we're all over this very wealthy county of Westchester that has these pockets of poverty. We're there, and we're there for our people. 51 years before, 51 years to come. Forever. We'll be here forever.
CEO of Westchester Health Center, Judith Watson, Dr. Judith Watson. Thank you for joining us on Irie Jam Radio. You will be back, because I want to hear so much more about you and your journey. Thank you for joining us here on Irie Jam Radio. Have a great day.
Thank you, ma'am. Thank you. All right.
Wow,
bye-bye.
wow. People, look here. Prevention is better than cure. You heard Ms. Watson say that prevention is better than cure. My ladies out there, if you have not scheduled your mammogram, the time is now. The time is now. My gents out there, if you have not gone and got your prostate checked, the time is now. Just get a physical. The same way the gas tank is on E, you have to change your oil and all that stuff for your car. You have to do the same thing for your bodies. Again, prevention is better than cure. Let us be healthy, people. Our health is our wealth. All right, with that said, we're going to jump to a quick commercial break. When we come back, more right here. Let the cocks crow. Irie Jam Radio. Jam.